Hello, beautiful people. I am the Alien Cat, and welcome back to my channel. Or if you are brand new here, welcome on in to my channel. For today's episode, we are going to be doing a bit of a Q&A type of a session. I used to host a Stammer awareness streams over on Twitch. I think I did like 3 of them or something. 3 or 4. I think it was 3. I don't remember. But during those times, so people would ask questions about like all kinds of things that have to do with a stammer. I also had people come onto the channel as well to talk about their experiences and everything. So I've kind of gathered most of the questions that people have asked during streams, and I thought I'd make a video about it here on YouTube, because why not? So the first thing that we are going to get out of the way are actually 2 things. One is, what is a stammer? So according to Mayo Clinic here, stuttering, also called stammering or childhood onset fluency disorder, involves frequent and is significant problems with normal fluency and flow of speech. People who stutter know what they want to say, but have difficulty saying it. That's that. And I also would like to go over my usual disclaimer. I am not a professional. I am not a therapist or a speech therapist either. I am somebody who has a stammer and has had it for her whole life. And I'm here to raise awareness and to maybe connect with other people who also have a stammer, because it can be a lonely thing. I've only ever met other people who have a stammer thanks to the internet, actually. I don't know anybody in person that has it really. So if you yourself also have a stammer, and if you're comfortable enough, I would like to hear about your story. And if you want, you can also answer these questions alongside with me as well. I would love to hear from you. And with that, let us commence the Q&A. Let's freaking go. So believe it or not, this question is actually one of the most common questions that I tend to receive. And that is, what is the difference between stammer and stutter? I hate that word. Whoever invented that word, oh my god. But as we also read from the definition of Mayo Clinic, it is the same thing. The difference between the two is that stammer is the British variation, whereas stutter is the American. But they mean the same thing. So. And the next one is, does your stammer occur in more situations than not? So the short answer is, yeah, there are definitely is situations in when my stammer can get worse. It can be anxiety, stress, sometimes even fear. But then there are times where even if I am anxious and stressed out, my speech is actually okay. And then there are times where I'm actually fine. You know, I'm not anxious, I'm not stressed or anything. But for some reason, I just have what I like to call a bad stammer day, where I stammer a lot more for some reason, and I don't always get why. So yeah, that is my answer. And the next question is there anything that can make your stammer worse or better? I like this question. So some things that can make my stammer worse is pressure, and if people are trying to rush me. Like, it kind of depends. Obviously, if it's a real emergency, I understand the need to push. I get that. But when it's a day-to-day it's type of thing, and there's no emergency, and people are just impatient and they try to rush you, like, that can cause it to become worse. And I tend to get angry also. Luckily for me, though, it hasn't happened too often, so I don't particularly care, or I don't like. It's just you know, just. But it is a frustrating thing, obviously, to have to deal with and stuff. It's like, but yeah. And I'm not actually too sure how to answer the second part of the question, like what things can make it better. I think for me, it's probably more so just continuing to practice the techniques and stuff that I've learned from speech therapy. I'm lazy, so I don't often do that. But other than that, Next question is, do you think Stammer and Tourette syndrome can have is something in common. This is interesting, actually. During my first year of streaming, so I would have some people come in to my chat and ask if they have, sorry, they would ask me if I had Tourette's, because like they would confuse the stammer for tics, which from the outside I can understand their perspective, I suppose. So that happened during my first year of streaming. Then my second year of streaming, it actually changed from Tourette's to ADHD. People thought I might have ADHD because of it, and it's like, I do not. So to fully answer this question, though, I will point this out again. I am not a professional. Okay, I'm not a professional. I have basic knowledge of stuff, but I am not a pro here. If there are actually professionals in the chat, I would like to hear your guys's professional opinions also on this. But from what I have gathered, Tourette's is a neurological thing. A stammer is also a neurological thing. I mean, there are other factors and stuff when it comes to a stammer. It can also be a genetic predisposition and other things. Like, there is more to it. But for the sake of this argument here, Tourette's is one thing, stammer is another thing. Now, both of them can exist in the same place, and one of them might make the other one worse. However, just because somebody has Tourette's, it doesn't necessarily mean that they have a stammer, and just because somebody has a stammer, that doesn't necessarily mean they have Tourette's, is what I'm trying to say. So yeah, from what I've gathered, both of them can exist in the same field, but they may not have any type of a direct correlation with each other. Next question. Do you stammer more, less, or the same in other languages? Oh, this is a good question. And my answer has actually changed in recent years. A few years ago, if you would have asked me this question about a few years ago, I would have said, no, I feel like I stammer more or less in the same languages. Also, for those of you who do not know, I speak English and also Hebrew. English is my mother tongue. Hebrew, I learned it as a second language, and I am fluent in it. But in recent years, I do believe that it is because I don't practice as much Hebrew as I do. I mean, my job is all in English. There's barely any room for Hebrew. The only Hebrew I actually practice and speak is if I meet up with friends, which can happen anywhere between twice a week to twice a month, you know? And with my parents, I speak both English and Hebrew as well. So the majority of my time I spend reading, writing, speaking, practicing English. So I feel like because I haven't practiced as much Hebrew, so my stammer is a bit worse. So as of today, yes, I feel like I stammer more in Hebrew than I do in English. A few years ago, that was not the case. Next question. So if I'm having a conversation with somebody and I tell them to take their time if they are struggling, would you class that as rude? Okay, that is an interesting question. If this were to happen to me, if I didn't know the person, I would think that they think that their intentions are in the right place, and for the most part, I do feel like that is the case. You know, their intentions are positive. You know, they're generally just trying to say it's all right. I like I'm good. I'll wait. Like, it's all good, and I do appreciate that. However, for me, how I would take it is that it would shift the focus more onto it. Focus that I don't want it to be focus. It's very obviously there. You know, it's an obvious thing, and like I can feel it and hear it. Others can hear it, so it's like it's obvious that it's there already. So for me, it would be more like trying to shift the focus onto it. Even though, again, I know that for the other person's side, I'm assuming this obviously that was not their intention, was to put the focus more onto it. It's just more so to say it's all good. I'll wait. Like, there's no rush. And I will say this also. I feel like if you're in a situation where, say, if you don't know the person, I would say the best thing is just to not even say anything. Like, just wait. Just wait and be patient as you would be anyway. So it would probably be best to just not say anything. If it's a friend, then it kind of gets a little bit more complicated, because it's one of those things where if the friend is ready to have, like, if say the friend who has a stammer, if they are the one who initiates the conversation, and if they're okay with questions being asked, then maybe you can talk about it. But if the initiation doesn't come from the person who has it, probably take the step back, because again, it's a friend, so I don't really know how to answer them. I just know how to answer if it were me. Somebody else who may also have a stammer might think differently than how I do, and that's totally fair. But I think at best, like, the best thing to probably do is to just not say anything. Just be patient, wait for them to say what they have to say, and that's it. As you would anyway. But to answer also that part of the question, I personally would not class it as rude. It might come off rude to some people. I don't know, which is why, again, it's probably best to just not say anything. And the last question for the day is, can someone with a stammer set off your stammer? I actually have a funny story with that, actually. So when I served in the Navy years and years ago, wow, it has been years since I served in the Navy. Oh my god, time flies. Anyway, so while I was serving in the Navy, a good friend of mine, who was also, like, we served on the same base actually together. So she told me one time, after she came back to the base after being at home for a few days, her mother asked her if she's been hanging out with somebody who has a stammer, because she started to stammer a bit. When she told me that, it made me laugh. It genuinely made me laugh. So to answer the question, possibly. I haven't really had many conversations with people who do stammer in order for it to be set off in that way, but I just wanted to share that story because it's relevant to the question in some way, shape or form, and it's funny, in my opinion. Yeah. So to answer it in a more personal way, I don't particularly know. Probably the possibilities there, I guess it also depends on the severity of the other person's stammer. If it's worse than mine, maybe. If it's better than mine, maybe I don't know. But that is my answer. Alrighty, and that is all the time we have for today. Thank you all so much for tuning on in. I appreciate it. As I mentioned at the beginning of the video as well, if you yourself have a stammer or have had one and are comfortable enough with sharing your story and your experience, I would love to hear about what you have experienced, and if you've also answered any of these questions alongside with me, I would love to also know your answers. Thank you all so much for tuning on in. I appreciate it so much. If any of you guys also have any questions that you would like to ask, feel free to leave a comment about it. And if you guys enjoyed this episode, please give it a thumbs up, and don't forget to subscribe to my channel for more videos every week. I appreciate you guys so much. Thank you all so much for being here. Until next time.